Hello, everybody. So happy to be here. And I just wanted to mention, for those of you who don't know, I've put out 3 different questions over the last day. So if you get a chance, you can check out those polls and answer the questions right now. And I will be talking about them later in the session. So I'll get some of the formalities out of the way. We're talking about communication today and sex. And I've got no disclosures, so we're good to go there. So hello, I'm here. That's me. Let's talk about sex, or let's at least talk about talking about sex. So what I'm going to do is I'll go over a couple of things before I introduce myself a little bit more, because of course this is the topic of sex, so that can be a challenge for some people, so I want to acknowledge that. So certainly this is a difficult, perhaps triggering at times. This is, like I said, talking about sex. So maybe a little less of an issue for some people, but still, of course, we're referencing this topic. I'll also be talking about things on occasion or making reference to something that maybe doesn't float your boat, and that's okay. There's nothing graphic that's going to be in the presentation. Having said that, there's a handout that goes with this, which is a PDF that you can access as well. And I whittled that down to a mere 10 pages of resources and extra information. So there are certainly some of the links there to different resources that might have more explicit or graphic stuff. So, as other people have mentioned, have some compassion for yourself. Take a moment if you need to leave, whatever you need to do. Of course, I want to honor that. And one of the things that you can do, certainly, is do some sort of grounding technique. So we've also heard from people about mindfulness and the importance of being attuned to what's going on with your body. So this is something that certainly falls within that, of when we're starting to feel a little disengaged, or like we're kind of floating away from the conversation, or we're starting to feel uncomfortable or anxious. So we can ground ourselves back into the present moment. And this is something that, of course, is very helpful when you're about to have a potentially challenging conversation about something like sex. So some of you may have heard of this particular tool on the last page of the handout. There's actually a bunch of other tools as well. And so this one, nice and easy. So 5, 4, 3, 2, 1, easy to remember. So the first thing on there is talking about 5 things that you can see. So right now, I'd love to hear from people. What are 5 things you can see in this room right now? Me. Anything else? The screen. The what now? Zebras. They're everywhere. Yes. What else? Chairs. People. Okay, so we got 5 things we're seeing. What are 4 things you can touch right now? My soft sweater, a table. What else? Glass of water. Yeah. Your friend. There we go. Got 4 things you can touch. 3 things that you can hear. Me. Water being poured. Cameras being clicked. Yes, absolutely. 2 things you can smell right now. Hopefully fear isn't one of them. What can you smell right now? Oh, what you got there? An orange, yes. What else? A mint. And then one thing you can taste. Got the mint again, water, yes, great. So pretty straightforward. And for any of you who maybe were feeling like a little anxious for a second there hearing about what we're going to talk about, perhaps while we answered those questions, you kind of forgot about that other thing. So maybe even just while you're using that particular tool, you are able to have a little moment of less anxiety or distress or whatever it is. So that's great. So keep in mind, though, of course, all tools don't work for all people. They don't work all the time, so we need many tools in the toolbox, or treasures in the treasure chest, as the case may be. And try them out. In the middle of a crisis is not a great time to start. So there you go, grounding. Something to keep in mind. Also, like I said, this is a big topic. So this is really planting a lot of seeds. As I said, there's this extra handout, and the first page on it talks about some self-reflective questions. So there might be some bigger things for you to think about afterwards. The other thing is, use that as something to start a conversation, right? Like, hey, today I was in this session and there were some weird things that were talked about. What do you think about that? Let's talk about it. So it's a great way to start a conversation. So lots of seeds hopefully getting planted today. So just a little bit more about me before I jump into what we're doing. My name is Martha, and I have EDS. I also have other chronic conditions, and so I've been managing several for most of my life. Very similarly to what I've heard so far in the conference, I've had lots of experiences in healthcare where I was not validated, not believed. There was a lot of, it seems like you're a bit depressed. Why don't you see a therapist? So this pissed me off, and I decided to work in healthcare. So I want to disrupt from the inside out. So I started as a recreation therapist, and guess what? We get to talk about sex a lot, actually. So that worked out. And I went on to other things, including doing HIV work, and I did a lot of counseling, taking sexual histories, talking about safer sex, including in a program that I started in sub-Saharan Africa. So I interviewed over 600 people and tested them for HIV on a high school campus where I lived. And I heard a lot of great stuff that is not even PG-13. So that's for later. But I spoke to students, teachers, and the nuns who ran the place. And those were the best sexual histories that I took. So lots of interesting stuff. I, in the last 8 years, have been training healthcare providers because I want to see change. So I train on chronic diseases and how to communicate with patients about that. Different counseling techniques, motivational interviewing, trauma-informed care, health literacy. So there is change that is happening, which is fantastic. Despite that, I still got a lot of not being validated or believed. And even as someone with a lot of professional experience, personal expertise, I'm a white cisgendered woman who has plenty of privilege, and I still wasn't getting a whole lot of traction with a lot of people. So if I'm having these issues, then it's really challenging for a lot of other people. So I heard the same lines again of maybe you should go see a therapist or something. And so in April of this year, I became a therapist. And who is one of my main people that I am going to be serving? Healthcare providers. it's a full circle moment for me. I actually focused on burnout in healthcare providers while doing my master's. The other place I want to be spending a lot of time is we have silos of physical health and mental health, and they shouldn't be. There's lots of intersectionality there, and that's where I would like to be. So all to kind of say that there's a lot going on, a lot with me and a lot with this subject. So talking about the idea of being multidimensional, or intersectionality is another great way of putting it. There are lots of different aspects to us. Of course, we are people, and when thinking about sex, sexuality, sexual health, this is something that is really important, and it's actually something that's identified by United Nations, World Health Organization, and WHO says good sexual health is fundamental to overall health and well-being of a person. And in a great move, because we have historically spent too much time pathologizing things about sex and sexual dysfunction or sexual health, so we've said, like, oh, let's shame you into using condoms so you don't infect other people with something. WHO added that an important aspect of sexual health is pleasure. So, yes, yay. So we've got that in there. So it's not just about function, which is sadly what a lot of research is about, is do the bits work? Well, then we're done. Our job is done. Congratulations. And a lot of people are left going, but this isn't what I wanted or what I thought it would be. So we've also got issues that relate to whether you identify as having a disability or a chronic condition or something else. There are additional considerations there, and some of them were touched on today, which is fantastic. Then within that, EDS or HSD certainly has stuff as well that we might want to know a little more about, common issues. So again, we're learning a lot of great stuff at this conference about these things. And then there's sex, sexuality. And so these are just a few of the parts of what make up our identity. And sexuality actually is a pretty big word. So there's a whole wheel of sexuality. And I would say that this is actually missing quite a few spokes. But in the handout, this comes from some sexual education material from Canada. It's got the wheel along with some definitions. It is meant for like middle school kids, but there is a lot of information that we could all learn about in terms of sexual education. So great resource. So these are different things where some might be more important than others to you. So when we're talking about sexuality, it's a big topic. Now it's getting even bigger. But there might be things on here that you want to focus on a little bit more. One of them could be communication. So in preparation for that, what the heck is sex anyway? What are we talking about? What does that term mean to you? So it's a lot more than a penis and a vagina. So that's important to think about too, is there are a lot of things that go into potentially what sex means to you, and being able to clarify that is important so that you can talk about it with somebody else. So another thing that can really affect that is unconscious bias. So there's lots of research about that in healthcare. Certainly we're all affected by that as well. When we think about sex, it is usually a man and a woman. They're young, they're fit, they're white, and there's a penis and a vagina, and boo-boo, sex. So it is a much bigger world than that. And so being able to expand that definition is more inclusive. It also then requires more communication around that, more understanding. So I'm not going to go into detail about these, but I wanted to highlight these are some myths or barriers that are very common when we're talking about sex and disability. And it's some food for thought. They come from the book that I would recommend the most, and it's in your handouts around sex and disability. So there's quite a few. Some of them are probably familiar, but that idea of that someone who is disabled doesn't have a sexual identity, or that they don't engage in sex, or that it's not real sex for some reason, or that you should be just really psyched that you're up and around. Like, why are you asking me about getting laid? So, no, these are things that we have a right to. And the other thing that came up earlier is that sex should be spontaneous. And no, it should not. And in fact, it rarely is. So the best spontaneous sex to have is well-planned sex. So make sure that your toys, your lubricants, your assistive devices are within reach. You do not want them after you've transferred into the bed, right? So you need to plan. And a lot of us are really good at that because we have to plan a lot of things when we go out, when we stay in. But nobody else was spontaneous either. When you were in a new relationship and you knew that you were going to do it that night, you cleaned your house, you made a special meal, you shaved all the bits, you got rid of the questionable things. You did a lot of work. There was nothing spontaneous about that sex. So just forget about that, okay? Some more myths that people can't be adventurous. People who are living in institutions should not have sex. Yes, they should. They can. It happens. I had a client who was in his 80s who happened to be HIV positive, got himself a girlfriend, and the response from nursing was to call his children and tell on him. So instead, I sat down with him and his lady, and we talked about everything. And at the end, they said, "Thank you, we're not dead, we're just old. And the things you said are maybe a bit much for us, so we're going to hold hands." And I said, "Great. You do what you want. You do what you need. But you need to be informed, right? It is so important." So sex education for all of us, including consent. Consent is like the most important part, and that can be quite sexy. So I'll touch on that briefly a little bit more. But having this information is actually helpful for dealing with number 7, which is unfortunately a disproportionate number of people are involved with sexual assault who are disabled. And some of that comes from not being treated as a sexual being who deserves information and education. So some things to think about. So creating some open communication involves just these 4 steps. Very easy. So no, it's not. I want to acknowledge that these are certainly things that are simple. That doesn't mean they're easy to do. And I wanted to share the results of the first question. So hopefully you guys have gotten that. And if not, I'll figure it out later. But the biggest things that come up are that people feel uncomfortable, anxious, and nervous about talking about this topic. So yes, that's a common experience. So things that you can do about that is you need to do some detective work. Language, vocabulary, those are important things. So there's lots of stuff in your handout for places to find out about anatomy and education and different terms. Also about different beliefs that we have. Interests, desires, again, right? It should be fun. We have lots of concerns, whether they're things that lots of people might be concerned about, or it could be specific to your condition. It could be about having to speak with your personal care attendant, about helping you with being set up for enjoying some masturbation. So there can be a lot of things that need to be communicated, and so it's important to know what is it that you want to say, what are you talking about. So knowing that, very helpful. So there is definitely homework or preparation before you have a conversation. How you want to communicate that message. Is it in person? Perhaps for some people it's by text, or maybe it starts that way. And that happens a lot with younger people or kids. You know, one of your kids might have texted you and said, hey, I've got a thing, I think I'm maybe gay. So we want to take advantage of those things. There's also, it's important to use I statements. So I'm feeling this way. I would like this. So again, there's examples. And it's something that takes practice. So maybe you rehearse by yourself or with a trusted friend. There's also thinking about, when should I do this? Not when somebody's about to go to sleep, not when you've just come home from a very long day and you want to murder your boss. So think about timing. Think about the other person and timing. If you're at the doctor's office, don't do it when their hand is on the door and they're saying goodbye. This idea we talked about earlier about being grounded or staying grounded during a conversation. Really helpful so that we don't kind of lose ourselves and have all the baggage start spurting out everywhere, and then what we wanted to talk about is completely lost. Also, actively listening is so helpful, and there are things that are really helpful, and one of them is to just listen. If you do nothing else, just listen when somebody is talking about a major concern, or when you express yours, listen to what they have to say. So being non-judgmental, being curious. What does that mean for you? What is that like for you? What has that experience been like? And respecting the no. You know, you've gone to all this effort to tell them something really important, but they might say, that doesn't really sound like a thing I want to do. So that sucks. And we have to respect the no, which is a part of boundaries and consent. And again, those are two words that people hear and we have a lot of feelings attached to them, and they're probably not great ones necessarily. But consent can be sexy. So there's two sides to it. And again, there's more elaboration in the handout about what are the three things in terms of getting and giving consent to others. And so it's frequently in the past been about like, can I put my hand here? Is this okay? And it can be quite uncomfortable. So we can practice. There's some great new approaches. One of them is in the book that I suggest about consent, which is in your handout. And I've heard this from a few other sex educators, which is consent is like pizza. So it's something you desire. Pizza sounds good to me tonight. What do you think? Oh, I could go for a pizza. Do you want like the works? How about like you get that on your half, and when you're done with that half, then I'll come in and we'll just have cheese pizza. Okay, yes. So we've negotiated. We have set some expectations. Maybe we can talk about, like, do you really want spicy peppers on there tonight? Maybe not. My pain is up. So there can be a lot of great ways to talk about that. The other thing, there are lots of things within what I've spoken about that are helpful for speaking with providers. And my slide on here has already been covered, which is great. It's so great to see that we have lots of overlapping and supporting each other information. So I'll just add that last piece at the bottom can be really helpful, is when I leave an appointment, can I answer these three questions? Do I know what's going on? What do I need to do? And why do I need to do it? So that can be very helpful. So I'll leave you with some final thoughts, and then I will share polls with you afterwards, because I'm like out of time. But one of the things that's important is in the poll about providers talking about sex, there was one person at the last time I checked who said someone asks on a regular basis. The others, it was like 50-50. So it needs to come up more often, and everybody's too scared to talk. So find out more, find out what you want, find out what your needs or concerns are, expand the spokes on that wheel of sexuality that are meaningful to you. Remember, again, sex is not just about function, it's about pleasure as well. And one of the things that I saw in the final poll was a lot of people said, if I feel heard by somebody else, I feel a lot of relief. I feel seen. And so think about what meaningful conversation could lead to for you. Thank you.